As dogs get older, so do their brains, but sometimes the signs of brain aging can turn out to be something else. Cognitive Dysfunction Syndrome, or CDS for short. This is a degenerative disease that's very similar to Alzheimer's in humans. In this video, I'm going to talk about the causes of CDS and some of the clinical signs, as well as some of the management options that your veterinarian might suggest for the condition. CDS is commonly seen in dogs aged 9 and older. It's caused by a gradual, age-related change in the brain, where neurons that are responsible for sending essential messages throughout the body start becoming less functional. Because it's a gradual, degenerative disease, CDS may be tricky to diagnose, particularly early on, as many of the symptoms are vague and can be related to other conditions. However, early recognition of CDS can help manage and slow down its progression. As CDS is a degenerative disease, there sadly isn't a cure or reversal, and the symptoms will worsen over time, so intervening as soon as possible can make a massive difference when it comes to our pet's quality of life. A helpful diagnosis tool vets use for CDS is an acronym called DISHAL. They'll look at a few things. Disorientation. Has your dog gotten lost in familiar places, stuck in corners, or been seen staring off into space? Interaction changes. Are they suddenly avoiding you or showing clingy, anxious behaviors? Do they not recognize familiar people? Sleep pattern changes. Are they wandering at night or sleeping during the day? House soiling. Are they going to the bathroom indoors when they've always been well house trained? Activity level changes. Are they no longer interested in playing or other activities that they used to enjoy? Anxiety. Do they have new or increased phobias, or are they suddenly irritable or aggressive? Note, that can be because of pain as well. Learning or memory changes. Do they struggle to learn new things or forget commands that they've previously mastered? A dog with CDS may have one, a combination, or all of the symptoms I mentioned. Every pet with the condition will be different. Because early intervention can be beneficial, it's important to take your pet for a vet checkup if you notice any of the above symptoms in an older dog. Based on the presentation of the clinical signs, your vet will then run a series of tests to rule out other potential health conditions. Often our initial database will include things like blood and urine samples to look for signs of things like organ dysfunction, inflammation, or infection. In some cases, we may also refer your dog to the veterinary neurologist for an MRI to check for diseases that might resemble CDS, such as a brain tumor. Sometimes the imaging can pick up signs of brain atrophy caused by CDS, but usually only in severe cases that have already progressed quite far. Sadly, there aren't any currently specific treatments for CDS, but it's still a disease we are constantly learning about and doing more research on. There are some things we can do to support dogs with CDS, helping preserve brain function and slowing the progression of this condition. The first is diet. Your vet may recommend a prescription dog food that's rich in antioxidants, fatty acids, and other nutrients that can help support brain health. And this would also be prescribed in conjunction with any other health conditions your dog has. There are some medications that can help manage your pet's individual symptoms as well. Depending on what country you're located in, there are different drugs approved for things like helping neurons communicate better or increasing blood flow to the brain, both of which can help in cases of CDS. Additionally, if anxiety is one of your pet's symptoms, a vet could prescribe a medication to help ease it. It's important to manage other conditions that are commonly seen in conjunction with CDS due to age, like arthritis. Chronic pain management is crucial for all senior pets, but especially those with CDS. Your vet may also recommend certain supplements. A common type used today are oils containing medium-chain triglycerides, or MCTs. These can provide the brain with energy as its cells become less effective at using their normal source, which is sugar. Which supplement may depend on your dog's symptoms and other medications, as well as other health conditions. Gentle, regular exercise can help too. Their favorite toys, puzzle feeders, playtime, and low-impact physical activity can give them essential mental stimulation that will often improve their sleep. Finally, having a routine can be beneficial for dogs with CDS. Try to wake them, feed them, and walk them at the same times roughly every day so that the routine becomes a habit and your dog knows better what to expect. Keeping a familiar layout in your home is also helpful for the same reasons. This comes into play as many pets with CDS are also concurrently experiencing hearing or vision loss. While researchers work to develop more advanced diagnostics and therapies, the best thing we can do for dogs with CDS is early intervention and support. Remember, in these cases, you are not alone, as managing a pet with cognitive dysfunction can be sad or challenging for owners. Getting the right plan in place with your vet can help improve your dog's quality of life and slow the progression as much as possible in hopes of allowing you both more enjoyable time together.